I'm going to talk today about some of the research that we've been doing in our lab at King's over the last few years, and mostly focusing on a project funded by the Medical Research Foundation, and thinking about a digital approach to alleviate pain in childhood cancer survivors. So I want to start by introducing you to Annie. So when Annie was 16 years old, she was living with her family in Brixton. And like many South London teenagers, she had a burgeoning interest in music and was training and learning how to be a DJ, and thinking about what her future life will hold after she finished high school and graduated onto college. But after experiencing some pain in her leg for several months that was getting worse, she went to the hospital and had an MRI scan and was diagnosed with osteosarcoma, which is a form of childhood bone cancer. Overnight, Annie's world changed and became radiotherapy clinics and hospital waiting rooms. And she spent the best part of a year in and out of hospital, receiving intensive chemotherapy and radiotherapy and surgery to remove the tumour in her leg. Now, luckily, Annie, as we know her now, is several years after finishing her cancer treatment. And Annie's story is, in many ways a success story. About 3,700 children and adolescents are diagnosed with cancer every year in the UK. And most of these young people will be like Annie, will go through intensive treatment and then will come out the other side and survive. And this is really thanks to groundbreaking medical research. About 40 years ago, 80% of children diagnosed with cancer would have died from their disease. Today, over 80% will survive their cancer and live many years into adulthood. But Annie has told us that, like many other young people who've gone through cancer treatment, they're often expected to go back to normal life once they finish. But actually, many young people finishing cancer treatment face a new normal, both in terms of what their lives will look like, and often they face and live with a new body. Annie also told us that this time is often one where there's a significant loss of clinical support. So often when you're going through cancer treatment as a young person, you're surrounded by a brilliant clinical team, oncologists, nurses, psychologists as well, to help you get through that very challenging time. When you finish cancer treatment, apart from going back in for routine scans and tests, there is a sudden loss of that support, both in terms of physical health, but also in terms of mental health. And many young people feel that quite acutely. And like Annie and many of the young people we work with, life after cancer is a time of great uncertainty, both in terms of what their life will be, what they want from life, but also uncertainty about what their body is capable of. So while we have this growing population of young people who are surviving their cancer and living many years, as I say, into adulthood, we have increasing evidence that this survival is not challenge-free, and that young people who've gone through an experience of cancer are at greater likelihood of experiencing major mental health challenges and physical health challenges throughout their lives. And we've got good evidence now that things like anxiety and depression are quite common in childhood cancer survivors. And we see that over a third of young people who've gone through cancer report clinically severe anxiety and fear of recurrence that interferes with their daily life. And although we have a bit less research on this, we have growing evidence that many young people who finish cancer treatment experience things like long-term fatigue and long-term pain. There's good evidence that over 25% of childhood cancer survivors experience ongoing chronic pain that can last for many, many years afterwards. And actually in our research, we tend to see that this number is quite a bit higher. So well over half of the young people we interact with in our studies say that they have ongoing pain that interferes with their life. I think the sort of dominant model we have of pain sort of still in society today is that pain is really a biological experience. Pain is the direct result of injury and damage to our body. But actually, the dominant model we work with in pain science is what we call the biopsychosocial model. And this sort of broadly speaking is the idea that every time we experience pain, whether it's an acute pain, short-term pain or chronic pain, that there are both sort of biological factors that contribute to that, so things coming from within the body, but also psychological and social factors, all of which kind of come together in the brain and to create that experience of pain. And there's been some beautiful work, including work, I think, funded by the Medical Research Foundation, looking at the biological factors that seem to predict which childhood cancer survivors will experience long-term pain. And so we know that there are certain kinds of chemotherapies that induce damage in the nerves and can lead to pain long-term. Certain kinds of surgeries as well seem to be a risk factor for experiencing chronic long-term pain after childhood cancer. But there was much less evidence really in the psychological experience of pain in childhood cancer survivors and the social context and how those might also play a role in how young people experience and manage their pain long term. So we've spent several years now in our lab studying sort of the psychological or the human experience of pain in childhood cancer survivors. And we started several years ago, this is when I was a postdoc in the US, with some qualitative studies. So these are interview studies where we talk with young people about their experiences of pain now that they've finished cancer treatment. And across several studies by our team and others, we really found that there's this close connection between the experience of even everyday aches and pains like headaches and uncertainty and fear for young people who've had cancer. And so one of our young people told us, I have a headache. Does that mean my tumor's back, or does that just mean I have a headache? So we saw that the meaning of pain seemed to change for these young people after cancer, even though in many cases, the pains they're experiencing are nothing to do with cancer recurrence and are either a consequence of their treatment or just, everyday life, part of everyday life. But what we also saw in these early studies was a kind of broader shift in the relationship that these young people had with their bodies and what we call sort of beliefs or mindsets about the body. And so one young person said, why did my body almost turn on itself? It had betrayed me. And another young person said that thought is something that's very difficult to come to terms with because then you can't trust your body. It's not there for you, it's working against you. And we've seen now in several studies that going through an experience of cancer, and actually we've done studies across many different illness populations now, including older adults who've had cancer or currently have cancer, but also we've done research on people living with chronic kidney disease, people living with diabetes, chronic non-cancer pain. Often that can cause this sort of shift in the way you relate to your body and perceiving your body as something that's working against you. It's not necessarily an ally anymore, but more of an adversary. So we've done, as I say, several studies where we've seen this kind of belief come up time and time again in people who are either living beyond or living with chronic illness. But actually, in all of our studies, we've also seen some other beliefs quite commonly come out in people living with and beyond illness. Many people who get diagnosed with cancer or other illnesses, they tell us that having seen their body go through treatments and recover in between treatments or keep going, despite the treatments they're receiving and despite the illness they have, has shown them how capable their body is. And we've also seen people holding the mindset that their body is responsive or even amazing. So I love this quote on the bottom. This is from one of our young patient partners in our studies who said that having gone through cancer treatment now 4 times and seen her body recover and heal after every surgery, after every treatment, she feels like her body really has its own healing magic. So I'm talking a bit about mindsets or beliefs that we hold about our body. But just to take a step back for one moment, what is a mindset? And so I think a lot of us use this term in everyday life to mean lots of different things. But in our group, we tend to use the definition that aligns with researchers out at Stanford, where I was for my postdoc, that our mindsets are essentially core beliefs about a domain or a category. And they help us to simplify complex or incomplete information about the world around us or about ourselves. And they do so in ways that matter. They create meaning and they motivate action. And we tend to think of our mindsets as sitting sort of in between personality. So personality is a kind of psychological factor that's a sort of a disposition in the way that we tend to approach the world. There's a lot of research on personality. And we do see that personality, things like how optimistic we are as humans, plays a role in how we manage illness. But the trouble is that personality is quite hard to change. So it's not necessarily a good target if we're thinking about intervention and supporting people managing illness. And then on the bottom here, you'll see the sort of situation-specific expectations and perceptions. And so these also seem to be impactful in the way that we sort of manage things like pain and illness. But they're quite specific and they often kind of appear in the moment. So, people often have expectations about whether their illness will last a short or a long amount of time, whether or not they'll get side effects from treatment. These also seem to have an influence on how we live with and pain and illness and how we manage that. But the trouble is that these kind of specific perceptions we have are relatively easily disconfirmed. So if you think that your illness will last a short time and then actually it lasts a long time, that sort of positive expectation is violated and won't necessarily be helpful for you in the long run. Our mindsets, on the other hand, we think of as sitting between these two things. And they're really beliefs about a broad construct. And so, for example, people have studied mindsets we hold about stress. So the kind of reality of stress is that stress is both debilitating for our health. It can make us sick and weak, but it's also enhancing. It can help us learn, it can help us grow. And the mindsets we hold about stress, whether we think stress is debilitating or enhancing, can have an impact. And relevant for us is that we also hold mindsets about illness and we hold mindsets about our body. And I think it's important at this point to say that because our mindsets kind of are about an often complex domain or category like the human body or stress, they're rarely right or wrong. So stress is both debilitating and enhancing, but the mindset we hold about it seems to matter. And the same is true in many ways about the body, especially in the context of cancer. So in order to start sort of doing more research on whether these body mindsets that we were observing mattered in how people experience things like pain after cancer, we needed to quantify it and measure it in different people. So Sean Zion, when he was a PhD student at Stanford, he developed a questionnaire called the Body Mindset Inventory. And this is essentially a series of statements. And people had to rate the extent to which they agree or disagree with these different statements. And this allows us to quantify or measure the degree to which people hold the mindset that their body is an adversary or the mindset that their body is capable or responsive. And we've used this questionnaire now in I think probably thousands of participants in studies in the US and here in the UK, and it's now being used elsewhere in Europe as well. But I wanted to just share one study that's particularly relevant for what I'm talking about today, which is a study my PhD student Emily Dowling did in just over 100 survivors of childhood cancer. And here, she found really big individual differences and variation in the mindset that these young people held about their bodies. So some of the young people in our study really strongly endorsed that understandable mindset that they felt like their body had betrayed them and failed them. Whereas other young people in our sample really strongly endorsed this mindset that their body was capable and responsive. And we did look in this study and actually in many other studies about how kind of objective medical factors related to these mindsets. So Is it the case that those young people who had more severe cancer and were more likely to have relapse were more likely to hold the mindset that their body is an adversary, whereas those who had kind of less severe cancer viewed their body as more capable? And in this study and now in many others, we found that there tends to be either a very small or no relationship between these objective medical factors and the mindsets that people hold about their bodies. So it doesn't seem to be that our mindsets are merely a reflection of our objective reality. But what Emily did find in this study was that holding that mindset that my body is an adversary, my body is working against me, seemed to be associated with experiencing and reporting more pain and interfering pain in these young people who were living after cancer. So our next question as scientists was, well, what's causing what here? Is it the case that, if you have ongoing pain after going through cancer treatment, that makes you feel like your body is working against you, and that's really understandable, and that probably can be true in many ways. But we also wondered if the reverse might be happening. We're holding that mindset that your body was working against you and constantly monitoring your body for signs and symptoms that it was doing so, and was maybe impacting the way that young people were experiencing and managing that pain. So the sort of helpful question we have for intervention was, well, can we therefore help young survivors embrace mindsets about their body that might be more helpful for how they experience and manage pain and mental health going forward? And so this led us to the Embody study, which was funded by the Medical Research Foundation, where we created an intervention called Embody, which stands for Exploring Mindsets About the Body. And this is a documentary film-based mindset intervention with the specific goal to help young cancer survivors identify their mindsets about the body and to really help them embrace the mindset that their body is capable of supporting them in their lives after cancer. I just say here, because I think this comes up sometimes, a lot of work went into deciding what was kind of the right mindset for these young people to hold. The right mindset for life after cancer is not necessarily that your body is invincible, because these young people do face risks with their body, including possibilities of relapse of their cancer. If there are things that come up, they need to go and get them checked out, and it may mean they need more treatment as well. So having the mindset that your body is invincible maybe isn't right, but holding the mindset that your body is capable, our young people felt like was a helpful mindset for managing pain and other things after cancer. So Embody is a really brief digital intervention, and that means that it's quite scalable. So it doesn't need to be delivered by psychologists, well-trained psychologists like in the cancer centre. We can essentially give this intervention to young people to do on their computers or on their phones, kind of at home or in their own time. The young people complete all of the modules online across 6 weeks, and actually the total time to complete all modules is less than 3 hours. And we co-created the intervention with a brilliant group of diverse patient partners, all of whom had gone through an experience of childhood cancer. And we spent 8 weeks. It was a very fun time of my life, meeting a film crew very early in the morning on the weekends, and we would go up to visit these young patient partners in their homes. And we wanted to film them talking about their bodies and their mindsets, and showing, how it's possible to sort of hold this mindset that your body is capable, even while living with pain and things like that after cancer. And we also wanted to show them using their bodies in ways that was meaningful for them. So I'm going to show you a quick clip now, and hopefully this will work for everyone watching from home. It might be a little bit jumpy, but there's also a link we could maybe share afterwards to watch it after. And this is just a few clips from that 6-week intervention. The whole thing is, as I say, 3 hours, and there's lots of different films, but what you'll see now is a few clips kind of pulled together from the intervention as a whole.
It did make me think, why has this happened? Why has the body done this?
I definitely had a feeling of feeling like I was being betrayed by my body.
Even today, 3 years after finishing treatment, I still suffer with really bad pain in my left leg and down my back.
I think there's always that underlying fear of, is it my cancer? Is it another cancer that's come back?
You feel like you've been removed outside of the world, and even when you finish treatment, you're expected to just go straight back into the world. The reality is that doesn't happen.
For me, that was the hard part of finding my place. Where do I belong in the world? What's next for me?
When we're faced with a challenge in life, we adopt mindsets, simplified lenses or frames of mind through which we come to understand our experience.
Part of the negative expectations I think we have in this culture is that medicine is all physical, that your body is just a receptacle, it's like a car, and you replace parts and fix things and that's it.
Recent science is showing really clearly that the mindsets we choose can have a powerful effect on how the body functions by controlling when and how to activate the body's self-healing systems.
And these different mindsets that we might have about our body might have consequences for how we relate to our bodies and ourselves, especially in times of challenge or difficulty.
Your cancer experience will shape the person you become.
It is about being kind to yourself, acknowledging that you've had this experience, but not letting it hold you back for the things that you want to do.
It shines a light on things of what really matters.
I genuinely feel a greater appreciation for my body.
I'm able to recognise how strong my body is and how it's carried me through everything.
Going through adversity, going through change, going through traumas, it can really mature you into a space that you would have reached much further along down the line.
You know, there are so many things we can't control and we can't change, but our mindsets are something that we can.
Using these strategies is something that will help you not just with your cancer journey, it'll help you in anything you want to accomplish over the course of your life.
Okay. So you saw there just a couple of minutes of a few different clips from our films. But the Embody intervention has 7 films in total that I said that young people watch over 6 weeks, and they're structured into these sort of 3 modules that young people complete. So the first module has 4 films in it, and it helps to introduce the idea of mindsets. You know, what is a mindset? And importantly, it sort of normalizes and validates, you know, that mindset that after going through cancer, you can feel like your body has betrayed you and turned against you. And in many ways, I'd say Embody is not aiming necessarily to reduce that mindset, because in many ways it's a truthful part of having gone through cancer experience. But it also introduces a kind of alternative, what young people think is credible mindset for living life after cancer, which is viewing your body as capable. And then in module 2, we talk a little bit about, you know, how it's possible to hold on to helpful mindsets even while facing challenges and setbacks. And this is where a lot of our young people talk about challenges they face with pain, you know, worrying about pain, but also living with that reality that, you know, they are at risk for things like relapse and secondary cancers. And we talk a lot about how it's important to go for scans and tests. And actually, sometimes, you know, feeling like your body is capable means you're more likely to go and get things checked out as needed, because you feel like your body maybe can handle more treatment and things like that if needed. And then in the last module, which is in week 6, our young people think a little bit about the tools that they've learned. We expand out to think about the mindsets we hold, not just about our bodies, but about kind of other things in life and the cancer experience as a whole. And then they write a letter, or they do a voice note or a video note to like a future self or a future survivor about what they've learned, to try and share that. And as I mentioned, so this is a digital intervention, and I think this is increasingly becoming an important part of our toolkit in medical care. And particularly for young people who've gone through cancer, they often don't want to come back into the hospital, you know, to see a therapist or to go through psychological interventions. And so providing something they can do at home, some of our young people do it on their phones, some of them on their laptops, is helpful. And as I mentioned, there's this series of films that's sort of the cornerstone of the intervention. But each time they watch a film, they then have to do these written reflection activities, which helps to think about how what they've learned and they've heard from these other young survivors makes sense for their life and the challenges that they're facing. And also from a research perspective, this gives us really rich sort of qualitative data to work with to understand how our intervention is working. So as I mentioned, the Medical Research Foundation funded our trial of Embody, and we are now, I think, just over 2/3 of the way through recruitment. And so we've been recruiting for the last several months, and hopefully by September we'll have 105 young cancer survivors across the country having been enrolled in our trial. We're doing a randomized control trial. So what this means is that when a young person consents to being in our study, we randomize them to either view the Embody intervention straight away, or to be on a wait list and to get the Embody intervention a year later. And this means that we can help to statistically compare, the effects of the Embody intervention on our outcomes, on things like health and pain, compared to just sort of interacting with our research team and completing surveys over time. And a big thanks here to Emily and Abby, who are sort of single-handedly running this trial, and they work tirelessly every day with brilliant clinicians at the Marsden, UCLH, Oxford, Southampton, and with our charity partners to help recruit for our trial. This is a rare disease population, so we need a lot of effort going into that. And here are the outcomes. So as I mentioned, we're still recruiting, so I don't have final data for you to present yet, but we will be looking at whether the Embody intervention improves health-related quality of life in our young survivors compared to the control group. And of course, we'll be looking at whether it helps them improve their experience of pain, and particularly the interference of pain on their lives. And then we have other outcomes like fatigue and other mental and physical health outcomes that we'll look at. But just to finish, although we don't yet have the final trial results and everything is blinded right now, what we do have is those letters and voice notes coming in from our young patients who have done Embody, and we're starting to hear about how it's been helpful for them. So I thought rather than end with my words, it might be helpful to end with the words of a young man who recently finished the Embody intervention, and he recorded a voice note for us and kindly consented for us to share it in scientific talks like this, and talking about how Embody's been helpful for him.
My cancer experience impacted the way that I thought about my body, in that I lost trust with my body. I already had a pre-existing condition, joint hypermobility syndrome, that made my life a lot more difficult than it was for other people. And so I already had a distrust to my body, and then this was kind of like the nail in the coffin. My body was not a safe place to be. It had failed me, and I'd lost all hope for it. It wasn't achieving the things that I wanted to achieve anymore, and that was really difficult. And I struggled again once I had my knee replacement slash partial amputation, and my world kind of went from I was getting better to now I've got another significant leap to recover from. And I think that's where I really lost hope for my body. I'd never thought of my body as being capable before the Embody study. I've thought that my body is wonderful and it's able to achieve amazing things, but to say my body is capable, that had meaning to me. My body is capable would have meant I could become an Olympian. But actually, no, my body is capable. It's capable of amazing things. It's capable of recovering. And it's capable of bringing me to where I want to be, what I want to achieve. When I've been believing that, oh my God, my body is capable, I've been driving physio. I've been relearning how to drive my car, and now I've got a full license. I walk up the stairs and I think I'm walking up the stairs. This wasn't achievable 2 years ago. And what I will use from these films moving forward is to trust my body and to trust myself to get to where I want to be. Your happiness is key. Your happiness is key.
Okay, so with that, I want to say a big thank you. It's been a mammoth effort to get this far, and as I say, our trial is still ongoing, and we have a whole team working on this every day. So thank you for all my team at King's and everyone who's working on this study. And thank you as well to all of the young people we worked with to co-design and co-create our research, and to fantastic clinician and charity partners that made it possible, and of course to the Medical Research Foundation for funding us. Thank you.